Yeah, and that probably adds on to what we're saying in terms of having to go look for the problems.
Yeah.
And so you have to be asking the right questions as a clinician as well, because, you know, the kind of symptoms that have, for want of a bit, have been a bit doctorified. So when you look at a list of symptoms for accommodation convergence problems, they talk about double vision because we've got two eyes. Oh, well, if two eyes aren't working together well, therefore we must get double vision. Now, honestly, double vision occurs, but it's not that frequent
Mm.
compared to all the other symptoms. And so I talk to patients about, you basically have two groups of symptoms. You've got what we call eye-related symptoms. And that's where myself as an optometrist and someone who's not an optometrist can discuss the symptoms, and we both might conclude that kind of sounds like an eye problem. Okay. So we've got, blurriness, double vision, sore eyes, tired eyes, and possibly some people might equate some headaches with that.
Mm.
And so you can kind of go, okay, well, they're the eye related symptoms. But you've got the other ones that kind of people may not immediately put down to it being a vision problem. And I tend to call them performance problems. So I'm not concentrating well, losing attention, losing my place on the page, getting bored while I'm doing the clear work, general concentration issues, maybe some depth judgment issues. And so those are the things that people may not realize, that they've been avoiding certain tasks
Mm.
because there's an underlying vision problem that doesn't allow them to do it well. And they naturally kind of just drift away from doing them.
Mm. So is this a condition that like mostly affects people who are doing near work, like students, office workers, that type of role?
That's when it's going to pop up most obviously.
Yep.
So as I said, as I've been saying, you can have some depth judgment issues if you've got a particular type of accommodation convergence problem. But more commonly, yeah, you're going to get into, they talk about something like digital eye strain. So, it's just eye strain. We call it digital
Mm.
now because most people are on digital devices. And,
Mm.
I will often joke that, when I was at school, it was, if you weren't academic, you were outside. So there weren't that many people getting eye strain. Whereas now it doesn't matter what your sort of level of engagement, involvement in school. If you use a device for long enough, you're at risk of developing some sort of eye strain symptom.